get and start just above you. So if you look up to the ceiling for me. As you can see, it looks a little excessive when we first do it. Creates a little lump underneath, and then we just mould that, smoothing it on. Very small. Now the filler wanted to come out, so it's going to move the skin around here, make sure it envelopes around. Again, now just do some moulding. Moving immediately, you can see it's very little volume immediately, especially on this side. This side's a little bit worse. So I'm going to be doing micro droplets like that. Yeah. Look, just very tiny little droplets, just to build it up, and we don't want to overdo it. So as we know, tear trough is one of the most problematic areas, and a lot of clinics don't do it. The reason we do it is because, personally, having tear trough for me, it's quite life-changing to my confidence, to everything. So I think it's one of those, if you can master it and understand it, obviously you still may have some issues, but it's about rectifying it, working with the client and making sure that you are committed to getting the best result. Sometimes that might mean doing less to start with and then building up slowly. Sometimes that might mean if the client retains fluid, and that can be down to diet or stress, then you might have to dissolve a little. But you can get a really good result with filler as long as you're using a minimal amount. So you can see here, if you compare that, so you can go to there, and compare the two. I'm going to do a little bit more natural to you might notice that we're not using cannula. And the reason why is because you just don't get enough precision. I think with cannula, I have a lot more problems with it. Yeah, it can prevent bruising, but as you can see, it's very little bruising, generally anyway. But when you have a client that has a very deep tear trough, then you have to go in quite a few times. It can cause bruising. You really can't get cannula effectively around this area, the lateral canthus, and you can't get it onto bone. It's very difficult to get it around the bone, whereas with a 30 gauge needle, you've got precision. Alright, just turn here. So I'm going to do a little bit more around your eyes and touch into your nasal labia folds, and then I'm going to show you so you can compare the two sides, so you can really get a good appreciation. I don't want to chase this line because we don't want projection here. Close to that transverse artery around here, the one that supplies the blood to the mid cheek, so we want to make sure that we do an aspirate and we're onto the bone. Okay, and I'm just going to mold that now. That good strong mold. So 0.2 cc's just there, and now we're going to just put a little bit more superficially. Again, important to aspirate. We don't want to do too much in this area. And if you notice, I'm not doing a retrograde deposit. I'm not doing a linear thread, and the reason for that is, when you come to zoom in, let's say the artery is across here. If I do this and I aspirate, I might not be in the artery, but when I inject and I'm coming out, and I do this, I then deposit into the artery. So that's why I like to do perpendicular and small micro droplets there.